In the news this week, asbestos risk, safety concerns over claims of dangerous waste mishandling in Perth South. A WAMN News exclusive.
Brace for impact. Nurses and midwives have stopped work next week as wage negotiations remain in deadlock.
Pauline Hanson touches down in Perth for another supporters meeting blitz.
Doctors advise masking up again as the number of cases is set to spike before Christmas. And later, Dr. Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. There are concerns about the safety of the Henderson Waste Recovery Park staff with claims of dangerous asbestos waste not being handled correctly. A local resident told WAMN News that asbestos waste was being dealt with by staff who allegedly had not been provided with adequate facilities to handle potential fatal asbestos waste. Madeline Lombardi with this exclusive report.
Safety concerns have been expressed over Henderson Waste Recovery Park's staff as reports of dangerous wastes not being handled correctly has circulated. WAMN News spoke with a person who will be named John for anonymity purposes, who was dumping asbestos correctly at the tip.
Quite shocking. It was primitive. The area was a sandy patch, uncovered. It had only a small sign reading asbestos drop-off points. Nothing else that indicated the dangers of disposing of this material.
John had carefully wrapped, taped and transported asbestos to the facilities. However, he found it lacked serious engagement for the safety conditions being met and accountability of transporting the dangerous cargo.
We had to remove fencing. We found out it was asbestos. So we went online and contacted our local council, and all the material was there that we needed to abide by, all the regulations and all that. And we took it very seriously, and it took great time and great expense to wrap it correctly, tape it correctly, and then transport it correctly.
John reported there was no dust suppression, no video surveillance, no water spray suppression, no alarm or emergency contact to raise spillages or exposures, and no proper flooring to capture and wash down asbestos. A spokesman from the Cockburn City Council, who was able to confirm union negotiations were underway with a new enterprise agreement, including better conditions than the previous agreement. Staff are currently worried about the high risk of contamination. The council will accept asbestos only if wrapped in an appropriate builder's film. They say the customer is to place the wrapped asbestos into a dedicated bin.
They have been raising these concerns to management, which is pretty incredible, for many years now, and nothing has been done.
John's main concern was respiratory issues when it came to breathing in the asbestos fibres within a public location.
There is no regulations in regards to transporting those dangerous materials. So as a visitor, I'm now very cautious and concerned that you can actually get sick by being there.
Cockburn City stated all staff is adequately equipped with personal protective equipment. Madeline Lombardi, WAMN News.
The public is bracing for hospital service disruptions as nurses and midwives go on strike in public hospitals starting on Wednesday. Rolling stop work will affect 12 public hospitals until the 30th of November as wage negotiations between the government and the ANF stay in a deadlock.
WA public hospital nurses will not be working this coming Wednesday as the Australian Nursing Federation push for better wages and conditions. The industrial action means 12 public hospitals in Western Australia will be hit as nurses and midwives walk off the job from 7 a.m. to 9 p.m. Fiona Stanley Hospital is the first hospital to be hit with strike actions this Wednesday as part of the rolling stoppages until the 30th of November. There's been no progress on Friday's Industrial Commission, but Australian Nursing Federation WA CEO Mark Olsen said they will work with the government to ensure patient safety.
It does, in large part, depend on whether the government will be responsible and reasonable and scale back its elective surgery, bring it back to just Category 1s and urgent Category 2s, and minimise the number of clinic appointments and start utilising their teleconference and video conference facilities. If they do that, then I think we can minimise the impact.
Premier Mark McGowan maintained that the current offer is the best offer compared to any other state. The Industrial Commission is set to meet again this coming Tuesday.
Nurse-to-patient ratios is what they were asking for. That is what will happen. It just takes us time to implement so there's no unintended consequences. They know that. There's no need for industrial action. The pay increases we're offering are bigger than New South Wales, Victoria or South Australia are offering. The ANF has got what they were asking for. There's no need for any further industrial action.
Controversial One Nation leader and Queensland Senator Pauline Hanson visited Perth this weekend to meet with supporters and attended an event as a guest speaker. The controversial senator stayed in Perth for 24 hours with a party members-only event. One Nation State Director Chung Chang stated that this will be part of her regular trips to WA. Multicultural advocates and leaders, on the other hand, expressed deep concerns over Ms Hanson's trip. Prominent CALD advocate Suresh Rajan responded negatively to Ms Hanson's trip.
People ask me to come, to different parts of the country, but I will be over in WA again, by all means.
What's your goal here today?
What's my goal? Well, we're going through registration at the moment as well for the party, and of course party members need to sign that declaration form which the Electoral Commission have just introduced, and if it's not signed, therefore what's going to happen is they will actually deregister the party, and the people that will lose out of that will be the voters.
The Australian Medical Association of WA is calling for an active policy to increase hospital beds and maintain the number at the national average. The top doctor based his comments on the latest report from the Australasian College for Emergency Medicine, which highlighted the lack of beds and capacity as the public hospital system is strained. Dr. Mark Duncan-Smith warns that hospital occupancy is at a record high and it will lead to more health issues.
So a hospital goes over 90%, you get bed block, you get ramping, and you get increased death rates and poor outcomes. Our hospitals in Western Australia, unfortunately, are frequently over 100% occupancy, as evidenced by over-census beds. Also in the report, it states that the emergency departments are meeting their targets for patients that get discharged home, so in other words, don't need beds. However, they don't meet their targets for patients that do need beds. This indicates it's not an efficiency or a performance problem with the emergency department. It is quite simply a lack of beds.
The McGowan government has invested $18 million into providing 4 new computer numerical control machines to build a strong local defence and industry workforce in WA. The machines, which were revealed on Thursday, November 10th, have been installed at the South Metropolitan TAFE Rockingham campus for student training. The machinery will teach apprentice students programming, setting and operation of the latest CNC equipment, multi-axis and ferrous and non-ferrous materials, whilst being used to support students in making components within the defence and other industries.
Students who are learning here are learning on state-of-the-art material. In addition to the $18 million available for equipment as part of the defence strategy, this is on top of the $215 million that we're spending on TAFE infrastructure across Western Australia and the $25 million on improving equipment so that wherever students are learning in TAFE across Western Australia.
Now to this week's virus update. The WA Health Department is reporting 8,029 new cases. 4,906 cases are currently active, 176 people are in the hospital and 5 in ICU. 6 historical deaths are dating back to the 29th of October, with people passing away aged between 77 to 92 years old. Overall, 7,760 PCR tests were conducted, 1,893 PCR tests were positive, and the total number of positive rapid antigen tests this week is 6,136.
Hundreds of dignitaries, citizens and current and former veterans attended a major Remembrance Day ceremony at Kings Park. The Remembrance Day event remains a significant event as it marks the end of World War I back in 1918. Flowers and tributes were laid at the State War Memorial Flames of Remembrance as members of the public paused to pay their respect for diggers.
Remembrance Day, Anzac Day, these sorts of days are important opportunity for us to remind ourselves and reinforce, the value behind that, but also remind the country and reinforce to them that there are people willing to do it, but you've got to do it for the right reasons.
You know, Melly, it's good to see the young and old gathered together for a good cause.
That's very true. It was an honour to attend the service, and lest we forget. We will recap this week's top stories in just a moment.
But right now, here's Madeline Lombardi with WP.
Thanks, Ivan and Melly. Welcome to Western Perspective. I'm Madeline Lombardi. Mask recommendations are back as the fourth wave of COVID hits Queensland, with the number of cases expected to peak just before Christmas. Hospitalisation numbers have doubled within 7 days, and experts say it's not a good sign before the festive season. AMA WA's Dr. Corinna Power joins us to discuss more. Dr. Powers, thanks for being here. COVID hospitalisations have doubled in Queensland this week. What does this imply?
It means that there's a wave happening, but in actual fact this is on top of a background of constant grumbling, rolling, smaller waves. We're actually breathing in what some have termed a variant soup of COVID-19 SARS-CoV-2 virus. So it's really important that we do everything we can to flatten this wave out, to take the pressure off our hospitals and our workforces, and obviously we don't want to be sick. We've got a festive season coming. We do not want to have our hospitals in gridlock. We do not want people being unhappy over a festive season because they've had to cancel, the hospitals have had to cancel people's surgeries. These things take a while to sort out once they've turned into a gridlock. I've already heard this is happening in the eastern states with hospitals having bed blocks and having to cancel procedures. So it's a very concerning time, and we need to do everything we can to lower the risk of this disease.
Queensland has encouraged people to wear masks as a recommendation rather than imposing mandates. Do you believe this is the right thing to do?
I cannot speak for the government, but anything that will help people actually wear a mask is important. And the Commonwealth recently put out an advice encouraging people to wear these good quality masks, a bit like the one I've got on. They're called N95s or P2 masks. The Commonwealth Health themselves recommended people use these masks, but obviously any mask is a help. And it's part of layers of control. And we do know that even young people can have serious outcomes from COVID-19, whilst mostly the elderly are experiencing a higher risk. It happens all the time that younger people and also children can have quite serious complications. We also are facing long COVID, and this cuts people's working ability. It's very important we wear masks, preferably high quality masks, and there's certainly a lot that the government can be doing to encourage that.
There are over 8,000 cases in Western Australia this week. What does this mean for the West?
Clearly we're having a spike of this disease, and I think it means that we just haven't done enough to prevent that happening. Ideally, if people are all putting a mask on their face to go outside and work, outside their homes and work and attend things and not just be in enclosed spaces with poor ventilation with no mask on, if we can all put a mask on, that's going to help save a lot of illness and disability in the longer term.
Summer is approaching soon, and the hot climate makes it difficult to wear a mask. What's your advice for our viewers this season?
I think if you're getting quite close to people in a crowded area, it can still be helpful to wear a mask, particularly if you're at risk with multiple medical conditions. It's still worth thinking about, but obviously the risk is lower outside, and preferably for our festive occasions, we do put them outside if we don't have a very well ventilated option or safe indoor air option. So there certainly can be times where wearing a mask outside is appropriate. If someone is unwell with COVID talking right into your face, and you're very close, it is possible that you may become unwell. So it's worth considering, but certainly the risk is far less outside.
And now here is AMA WA spokesman Dr. Andrew Miller with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. Well, if you'd had any doubts about which direction the pandemic was going to go in from here, they should have been dispelled this week with the news that hospitalisations are on the rise across the country. Governments are talking about people needing to wear masks, and the WA Chief Health Officer predicting that we're going to see a peak of cases late in November. Hopefully that will be the case and that it won't carry on after that, but we're flying a bit blind these days because there's very little PCR testing going on, which is really the most accurate way of telling what the numbers are like in your community. And we know that this XBB variant, which is making up about 10% of cases in WA on estimates at the moment, is incredibly easily spread. So N95 or better masks are going to be the best protection. The ones KN95 with the loops around the ears are certainly better than surgical type masks. And you should be thinking about wearing those whenever you're going into shops or into public transport, certainly into medical facilities or aged care facilities, or even into the homes of people who are vulnerable to the disease, people who might be on chemo or elderly people. When I say vulnerable, I mean vulnerable to the severe outcomes of ending up in hospital. Of course, this is choking up our hospital system, making it difficult to deal with other things. So apart from just looking after yourself, it also means you're helping out the community if you don't end up unwell enough to need treatment from the disease. Where to from here? Well, we'll see whether the government's serious about slowing this down. I think they'll have to realise that this roller coaster ride that we're going through is unsustainable in the long term, and that we need to probably revert to wearing masks whenever we're in public, crowded indoor locations that don't involve eating and drinking, and the places where we need to take them off. We've got to really closely look at the ventilation. That means measuring CO2 levels, getting it down below 800 parts per million. In many crowded places, it's sitting on 1,500, 2,000 parts per million, and it'll get there very quickly inside an Uber if the air conditioning switched to recycle. So just being conscious of the clean air that you need to breathe, and also having a plan. If you're an older person or someone with medical problems, having a plan to get hold of those antiviral medications. We do need to be putting pressure on the government around vaccination of our youngest kids. They've started it up in Hong Kong now. Most countries in Asia are doing it now for children under 5 years of age, as well as, of course, the US, Canada, Singapore, world-leading medical places. So let's keep that pressure on, because we know that there is the potential for long-term health problems with repeated infections. And of course, the maths shows that the younger you are, the more likely you are to have a high number of infections of SARS-CoV-2 throughout your lifetime. The DNA damage that's measured with the reduction in a thing called telomere, the telomere length, is quite dramatic from SARS infections. So that is something that's associated with damage to the DNA repair mechanisms. We don't know what that means for the long-term outcomes of kids, but what we can say with some certainty is that the less infections you have, the less number of times you're exposed to this, even if the acute disease is not that problematic, the less likely you are to be building up a long-term debt in terms of disease for the future. So let's be sensible, continue to prevent where we can. No need to panic, because we know the things we need to do. Thanks for your time.
That's Dr. Andrew Miller. Here's a brief weather update. Cold temperatures aren't leaving Western Australia just yet, as the mercury will just stay above 10 degrees for the entire week during night time. 26 degrees on Monday and a maximum of 29 on Tuesday, 23 on Wednesday and down to 21 on Thursday, plus sunny and clear skies throughout the week. And that's all from Western Perspective for now. Until next weekend, it's back to you, Ivan and Melly.
Sunshine throughout the week is something we all look forward to. Thanks, Maddie. Right now, here's Leo with what's coming up on 6 News tonight.
Thanks, guys. Coming up on 6 News, COVID cruise ship, the Majestic Princess, to begin its next trip after more than 800 passengers with the virus disembarked in Sydney. Horror crash video shows the moment two planes collide mid-air at an air show in Dallas, Texas. And independent candidate Sophie Tawney to challenge the VEC if they reject a how-to-vote card that leaves some boxes blank ahead of pre-polls opening in the state election. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News AU to find us, or head to our website, 6newsau.com. For now though, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs, with the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.